What's up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. All right, so let's take a look at medical malpractice here on Reddit. Here's some good stuff that we can go over. I'm kind of interested in this topic of medical malpractice. I have a great book, I don't have it here, that I'm reading right now on this topic. So, is it worth a look? So, this is a Reddit forum. This is a place where people come and ask questions of, do I have a case? Can I sue the doctor? Can I sue the hospital? And the motivations and the intentions are obviously all over the map. What's important when you read something like this, it's important to first understand that you as a physician are naturally going to get upset when you read something like this, because we believe what we're doing is valuable, is important, and nobody should sue us for something that we're doing. And our intentions should supersede any kind of errors or mistakes. But you also have to understand it from the perspective of the patient, especially if the patient themselves were harmed, and just as much if they lost a parent due to something like that. So let's take a look at this one. Is it worth a look? My mother-in-law, 70, passed away recently from a seemingly sudden heart attack. She had been suffering with ear pain for a few weeks and had been to the doctor and prescribed medicine and left to get on with it. It has now become apparent that this can be a symptom of heart problems in women. It wasn't detected by the doctor. What can we do? So she was suffering from ear pain, and she was prescribed medications, and apparently this person says, could the ear pain have been a sign of a heart attack? And this goes back to a lot of the discussions we're having right now, where women are presenting with many different types of symptoms, and sometimes it can be related to just very vague symptoms like fatigue and nausea and headaches. All of that can be signs of a heart attack. But of course, you have to think that this person whose mother-in-law is 70, and this person themselves probably in their 30s or so, 40s, is assuming that, well, if they went in for ear pain and it could have been a heart attack and it was missed, is there any kind of malpractice? And so let's take a look at some of the answers. Ear pain is incredibly non-specific, unless she was endorsing other obvious symptoms, not really negligent. She had chronic high blood pressure and was taking medications for this. Still quite vague, I suppose. So even this person understands that the things overall is vague. I would want to know, what is it you're looking for? Let's say that the doctor did miss a heart attack. What would you want done, right? And if the doctor did miss a heart attack for something like ear pain, do you think it is reasonable for somebody with ear pain to also be considered for a heart attack? If you're in your 70s and you go in for ear pain, would you want to be screened for a heart attack as well? And what does that screening really entail? That's another one. I'm sorry for your loss. I don't think you have a case based on information provided. Now, there's a lot of answers here where somebody's like, I don't think you have a case. Well, it doesn't work that way. You can't really determine if somebody does or doesn't have a case because you don't have all the details of the situation. And even though many of these people here are either attorneys or physicians, etc., you don't know what state they're in, you don't know what country they're in. So a lot of this stuff is interesting to read. Isolated ear pain would be incredibly rare manifestation of unstable cardiac disease. I think it's a bit of a leap to assume this was the case. We don't use the word unstable in medicine anymore. Even if it were, this is a diagnosis that will elude many reasonable clinicians. That is true. There is, in malpractice cases, if the event is very, very rare and most physicians, based on standard of care, would miss it, you actually would be held not liable to have caught that, right? But not always, because you might go to court and the jury might decide otherwise. Standard of care is not miss the diagnosis that reasonable clinicians are expected to make routinely. It is not missing incredibly rare atypical presentation that a significant proportion of other clinicians would have also missed under similar circumstances. I'm sorry for your loss, but hindsight is often 20/20. It would be completely unreasonable to work up every person with ear pain for a heart attack. Yeah, I mean, I think that's reasonable, but again, I think this is a tough situation all around. Has anyone actually won a case, either through settlement or through a trial? How was your experience? Feel free to message me if you feel comfortable being that way. In what country and state and province? Yeah, obviously, a lot of this stuff is public, and a lot of people have won these cases, and these are civil cases. These are not criminal cases, so people have both won and lost, but the majority of physicians do end up winning. That's the fact. The majority of cases end up being in the favor of the physician, and very few end up being a case in the favor of patients. Most get settled out before they even go to trial. So that's important to understand. This one, I'll give you a synopsis of this because it's rather long, but essentially this patient went to an NP, a nurse practitioner, and had some coccydynia and was diagnosed with coccydynia after an x-ray. But at no point did anybody say that at no point did the nurse practitioner say that this person could have had a pilonidal cyst or abscess. So obviously it's not a pilonidal cyst, it's a pilonidal abscess, because later on the patient went to, I think 12 hours later, they went to the emergency room. They had tachycardia and they had a normal blood pressure. A white blood cell came out at 25. The patient here is calling it, they were diagnosed with sepsis. They were taken to the operating room to have it removed, the cyst or the abscess removed. And they basically said that they themselves, this person is also a nurse, and the entire medical record from the nurse practitioner was a joke. My original medical record from the MedExpress are a joke. There's no mention of my awkward gait, no mention of me being tachycardic. They didn't list any of the meds I was taking, and said basically why I didn't have a fever. They failed to mention any of the complaints that I was having, chills, sweats, etc. Anyway, this is in Arkansas. So the person is asking, do I have a case against this nurse practitioner and this MedExpress? So the first question is, what do you want? What do you want out of this? Do you want your bills for the emergency room to be covered? Let's say you had, $2,000 of emergency room bills. If that's the case, usually you can call MedExpress and say, hey, this is what happened. I had $2,000 of bills because you guys missed my diagnosis. What would you like to do? MedExpress might say, you know what, we had a discussion with our nurse practitioner. You're right, the note wasn't very good, and I'm sorry you had a bad experience overall. We're comfortable covering half of your bill, for example. Or no, we're not going to cover any of your bill. Or, of course, MedExpress can become totally defensive and say, you're going to hear back from our lawyer or something like that. But the proper thing to do, of course, for MedExpress would be to say, hey, let's have one of our lead physicians talk to you and see what the situation is. And after the fact, after they do a review, and say, you're right, we did really drop the ball on this, and we would like to extend, a certain amount of money on you, a certain amount of money to you for your pain and suffering and for the emergency room visit. Now, the patient might also want to be reimbursed for any kind of pain and suffering or missed time from work. Now, of course, if this person was a professional athlete making $1 million a month, that's an extensive amount of pain and suffering. So this person might really sue and get a lot of money. If not, and if there was no permanent damage, it's difficult. And of course, any attorney is going to argue, well, when the patient came in, this may have been a closed off abscess that wasn't leaking anywhere. Of course, she's saying that the heart rate was elevated, etc. So there would need to be some explanation for that. Somebody can say it was due to pain. The temperature was normal, and obviously sepsis is not really what was going on here. It seems to be that the person was just having a simple reaction to an infection. And in all fairness, this was missed. This was missed by the nurse practitioner, but certain things get missed, and that's part of practice. But it is important for us as physicians to kind of have a finger on this pulse of malpractice and the kind of things that people ask. And the advice that was given was, so you were already septic and would have been sent to the ER if MedExpress diagnosed you correctly. So treatment remains the same. So what are you claiming as damages? Okay, so what this person is saying, let's say you went to MedExpress. Let's say you were sent to the ER. Let's say you were sent to the ER and your treatment was appropriate. What damages would have occurred? And what if you didn't get sent sooner? What are the damages now compared to had you gone sooner? And it's a valid point, because damages is an important part of this kind of malpractice stuff. Of course, the question is, if you went to the urgent care and you really didn't have an urgent issue, you had more of an emergent issue, what responsibility is there on you as a patient to make sure that you go to the right facility? Because if this person is trained to be a walk-in clinic or express care or urgent care, they may not have the capabilities of assessing and recognizing all emergent cases. And then they say, I disagree with everybody bashing the nurse practitioner. If the actual diagnosis was similar to a spinal epidural abscess or similar, they're notorious for being discovered late stage. So they're saying, hey, it's not a nurse. I guess other people have ripped on the nurse, this person being a nurse practitioner. If all this person had at the beginning was tailbone pain without neurological symptoms or outward signs of infection, I'd have done the same thing. Fair enough. There's a lot of missing to make a judgment about the initial nurse practitioner fucked up or whatever. I bring this up because I've seen every patient I saw with low back pain, slight tachycardia, neurologic symptoms, or fever to the local ER, I'd likely be out of a job. If I sent every patient I saw, okay, yeah. So this is a valid point, right? So if we see somebody with low back pain, and it could be an epidural abscess, a spinal abscess, or osteonecrosis, or stress fracture, or something like a pilonidal abscess, if we sent all of these people to the ER, what might happen? All of a sudden the ER would be inundated. So what should we do? What are you supposing? What are you suggesting as a patient? Do you understand the entire healthcare scene? And it's not the job of the patient to understand the entire healthcare scene. I recognize that as well. Some people are saying that the nurse practitioner was reasonable. Other people are saying you learned your lesson, never go to a nurse practitioner again. APRNs are not doctors. You can't sue for what might have happened. Your outcome needing surgery and antibiotics would have been the same even if you've been diagnosed 12 hours earlier. Well, yeah, that's true. So I think it's a valid point, but there's a lot of arguments I could make against that. Yeah, just pissed me off. I knew this answer already in the back of my head. I just had to suffer longer for no reason. Yeah, and that's the situation with health. I think we forget that we're going to suffer. Our health is in a constant flux. The definition of health, according to Dr. Andrew Weil, is that it's a homeostasis of wellness and not wellness, right? Up and down. And we're going to be spending time not feeling well. When we engage with a healthcare practitioner, that person can help triage us into certain, whether you need to be in the urgent care, emergency room, telehealth, whatever, but they can also intervene earlier versus later. That's health. There's no way around it. You cannot shortcut the process. Anyway, I thought this was good. There's a bunch of them on here if you guys want to check them out and just have fun glancing through it. But I thought I would do one kind of live on YouTube for you guys. Tell me what you think. Leave some comments. What do you think? What do you think about malpractice in the USA? Does it need to change? Is it good? Is it bad? This is another good one here. This one talks about a patient who had a hysterectomy for really severe. She went in for really severe bleeding, and when she went in to the surgery to have, I think, a cyst removed or like something, the surgeon found that she has severe endometriosis all over. The bleeding was really bad, and then spoke to the next of kin, which was her husband, and the husband gave permission to have the wife's uterus removed. So the patient essentially got a hysterectomy without her permission. However, remember, if you have a next of kin and you go into surgery, that's the way it is. Your next of kin is going to give the permission, and it may not be something that you like, but if that was your next of kin and you did not assign somebody else, unfortunately it is kind of essentially consent. Anyway, read it for yourself. That's it for me, guys. Take care.